Hello guys, hello friends, hello G's, it's your boy again, Falling with a Star. So guys, today we are going to look at the anatomy of the heart. And at the end of this session, I hope you guys get to know the location and weight of the heart, the borders and surfaces of the heart, the cardiac walls, because the heart is being surrounded by walls, the internal features of the heart, conduction system, and also the coronary circulation. Now let's look at the location of the heart. The heart is actually situated at the mediastinum. Let me write it here, mediastinum, which is actually the middle part of the thoracic cavity. The middle part of the thoracic cavity. But let's go into more detail. But before that, let's look at this structure here. This is the thoracic cavity, and this is the sternum, and these are the ribs. You understand? But the mouth of the ribs are called costal cartilages. Costal cartilages. The mouth of the ribs are costal what? Cartilages. When you look at the right border of the heart, you can see that the right border of the heart actually extends from what? The third costal cartilage on the right side, with its base being on the what? On the seat costal cartilage. So it extends from the third costal cartilage to the seat what? Costal cartilage on the right side. Also, when you look at the inferior border, you can see that the inferior border also extends from what? The seat costal cartilage on the right side to the fifth intercostal space. See, this is the first intercostal space, second, third, fourth, and what? The fifth. You understand? So it extends from what? The seat costal cartilage on the right side to the what? The fifth intercostal space on the what? On the left side. When you look at the left border, you can see that the left border actually extends from what? The second what? Costal cartilage to with its base at the what? At the fifth intercostal space. So this is actually the main location of what? Of the heart. And when you look at the heart, you can see that most of its part is on the what? On the left side. So we say that 2/3 of the heart is on the left side and 1/3 is on what? The right side. Also, averagely, the heart weighs from 200 to 300 grams, and it is more heavier in males than in females. So now let's look at the borders and surfaces of the heart. The borders and surfaces of the heart. So this is the anterior view of what? The heart. And when you look at the anterior view, you can see that the heart presents with three borders. We have the right border, the left border, and also the inferior border. You can see that the right border is mainly being formed by what? The right atrium. The right atrium. Understand? And the left border is mostly being formed by what? Or mainly being formed by what? The left ventricle, with a small part of what? The left atrium at the top. And the inferior border is mainly being formed by what? The right ventricle, as you can see. Also, the heart presents with three surfaces. We have the anterior surface. This is the anterior surface. And opposite the anterior surface, when you look at the back of the anterior surface, you can see the posterior surface. And also, this part is called the inferior what? Surface. Now, let's look at the anterior surface. The anterior surface is also called the sternocostal surface, as you can see here, the sternocostal surface. And this is because the anterior surface of the heart faces what? The sternum and also the ribs. When we say costal, it's related to what? Ribs. It faces the sternum and what? The ribs. That's why we call it the sternocostal what? Surface. Now let's look at the posterior view so that we can talk about the posterior surface. So this is the posterior view. This part is not included. This is the posterior view. And when you look at the posterior surface, you can see that it is mainly being formed by what? The left atrium, actually receiving blood from what? The 4 pulmonary veins. These pulmonary veins bring in oxygenated blood from the lungs to the what? To the left atrium. You understand? And this part is the inferior surface. Maybe you cannot see it well, but this part represents what? The inferior surface. And the inferior surface is very flattened, and it lies on the what? On the diaphragm. And because it lies on the diaphragm, we also call it the diaphragmatic what? surface. As you can see here, diaphragmatic what? Surface. It lies on what? On the diaphragm. And the diaphragmatic surface, or what? The inferior surface, is mainly being formed by what? The left ventricle, or let me say 2/3 by what? The left ventricle, and 1/3 by what? The right ventricle. Now let's look at the cardiac walls. The heart is referred to as a muscular pump, meaning its walls are mainly being made up of what? Muscles. You understand? And when you look at the heart, you can see that it consists of 3 distinct layers. It consists of what? 3 distinct what? Layers. We have the inner layer, the middle layer, and the outer layer. You understand? The inner layer is called the endocardium, and it lies the inside of what? Of what? The heart. And it continues with what? The endothelium of what? Of the blood vessels. You understand? So the inner layer is called what? The endocardium. The middle layer, which is the thickest part, is called what? The myocardium. The myocardium. And when you look at this diagram, you can see that this green part represents the what? The myocardium. And you can see that the myocardium is thicker in the ventricles than the atria. You understand? These are the atria. And you can see that the myocardium is what? Thicker in the ventricles than what? The atria. And even when you take the ventricles, you can see that the left ventricle, the myocardium of what? The left ventricle is thicker than what? The myocardium of what? The right ventricle. And this is because the left ventricle actually pumps blood to the whole part of the body, but the right ventricle only pumps blood to the lungs. You understand? Yes. And now the outer layer is called the epicardium. And this epicardium is the same as what? The visceral layer of what? The serous pericardium. When I was talking about pericardium in our previous video, I said that it consists of 2 main layers. We have the fibrous pericardium, which is the outer layer, and the inner layer is called the serous what? Pericardium. And also I said that the serous pericardium is further being divided into 2 layers, which is the parietal pericardium, which is the outer layer, and the visceral pericardium, which is what? The inner layer. And this visceral pericardium is the same as what? The epicardium of what? Of the heart. And between the visceral pericardium and the parietal pericardium, I said that there is a what? A cavity called the pericardial what? Cavity. And this pericardial cavity is being filled by what? Pericardial fluid, which actually helps the heart to move with slight friction. You understand? Yes. So that's for what? The cardiac walls. So guys, now let's look at the internal features of the heart. The internal features of the heart. So this is the internal surface of the heart, and you can see that the heart is being divided into 4 chambers. We have the chambers at the top called the atria. Atria is the plural form. One is called atrium. So we have the right atrium and the left atrium. And these 2 chambers are also called the ventricles. So we have the right ventricle and also what? The left ventricle. So let's take the chambers and look at them one after the other. So now let's look at the right atrium. This is how the right atrium looks like. It consists of 2 main cavities. We have the main cavity, which is from this part to this part. This whole part is called the main cavity. And this smaller outportion side is called what? The auricle. So we have the main cavity and this smaller outportion side called what? The auricle. So this is how the shape of what? The right atrium looks like. Now you can see that there are 3 main vessels that actually empty blood into the what? Into the right atrium, and they are the superior vena cava, which actually brings blood from what? The upper part of the body, and the inferior vena cava does that for what? The lower part of the body. And we also have this opening called the coronary sinus. The coronary sinus actually brings blood from what? The myocardium into the what? Into the right atrium. In newborn babies, there is actually a hole here that actually serves as a communication between what? The right atrium and also the left atrium. But as one grows up, that hole closes up and forms a scar tissue called, so it closes up and forms a scar tissue called called fossa ovalis. Fossa ovalis. Fossa ovalis. So fossa ovalis is the scar tissue in the what? In the right atrium. When you also look at the external surface of what? The right atrium. This is the external surface, the anterior surface to be precise. You can see this C-shaped groove. This C-shaped groove is called the sulcus terminalis. Sulcus terminalis. And this C-shaped groove actually goes inside and forms this structure here called the crista terminalis. Let me use this spoon as an example. Let's say that this is the external surface and this is the C-shaped groove called what? The sulcus terminalis. It actually goes inside and forms this structure called the crista terminalis. Hope you understand. Yeah. And that's for what? The right atrium. Let's look at the left atrium. The left atrium is actually similar to what? The right atrium. Just that when you look at the external surface of what? The left atrium, is very smooth. It doesn't have this sulcus terminalis. You understand? And also the right atrium is smaller, or the left atrium is smaller than what? The right atrium. The left atrium is smaller than what? The right atrium. Now let's look at the ventricles. But before that, let's look at something here. You can see that the right atrium is actually separated by this left atrium by these valves. But in reality, there is an opening here. There is an opening here. There's an opening here. Yeah, and that opening is called the anteroventricular orifice. Anteroventricular orifice. And this anteroventricular orifice is being guided by these valves. And these valves are called the tricuspid valves. Tricuspid valves. They are called tricuspid valves because they have three what? Cups. You understand? That's why we call this the tricuspid valves. And this tricuspid valve actually prevents the backflow of what? Blood from what? The right ventricle to what? The left ventricle. So in reality, you can see that these valves are being held tightly by certain cords. Certain cords we call the chordae tendineae. So there are certain cords that actually holds these valves tightly, so that they will be firm. And these cords are called the chordae tendineae. Let me write it here. Chordae tendineae. You understand? The chordae tendineae. So the chordae tendineae actually holds the valves firmly, and it attaches or it holds the valves to what? Certain muscle on the walls of the ventricles. There are certain muscles on the walls of the ventricles. These muscles are called the papillary muscles. And the chordae tendineae actually attaches to what? These papillary muscles. So these papillary muscles actually holds the chordae tendineae tightly, so that they can hold the valves firmly. Hope you understand. Yes. And also when you look at the left side, you can see that the left atrium is also being separated by this right atrium by these valves. But these valves are called the mitral or bicuspid valve. Mitral or bicuspid valve, because they have only two what? Cups. You understand? So the mitral or bicuspid valve actually separates what? The left atrium from what? The left ventricle. Now let's look at the left ventricle, the right ventricle into detail. The right ventricle into detail. So this is the right ventricle. It is triangular in shape. When you look at the right ventricle, you can see that it is triangular in shape, and it consists of two main cavities. We have the main cavity from here to here. This whole part is the main cavity, and the angle here is called the conus arteriosus. The conus arteriosus. The conus arteriosus. You understand? That's the angle here. You understand? And the right ventricle is being covered by a certain muscle we call the trabecular carnia. Trabecular carnia. So this trabecular carnia is a muscle that lines the whole of what? The right ventricle, except this part called the conus arteriosus. So the trabecular carnia doesn't closes or doesn't line the what? The conus arteriosus, but it lines the main cavity of what? The right ventricle. When you look at the left ventricle too, you can see that it is also being lined by what? This muscle called the trabecular carnia. You understand? The trabecular carnia. This right ventricle actually pumps deoxygenated blood to the lungs through this structure here. You understand? It pumps deoxygenated blood to the lungs through this structure here. And this structure here is called the pulmonary trunk. The pulmonary trunk. You understand? This is the pulmonary trunk. And this pulmonary trunk actually branches into what? The pulmonary what? Arteries. So these are the pulmonary arteries. So the pulmonary trunk branches into the what? The pulmonary arteries. And when you look at the pulmonary trunk, it also have a valve that guides it, is opening. A valve that guides is opening. And this valve looks like half of the moon. It looks like half of the moon. So we call this valve semilunar valve. So this is the semilunar valve of what? The pulmonary trunk. When you look at the aorta, this is the aorta. The opening of the aorta also have this valve called the semilunar valve, but it's the semilunar valve of what? The aorta. You understand? When you look at the left ventricle, the left ventricle also pumps blood to the whole part of the body through what? The aorta. So this is the aorta. This whole thing is the aorta, and this is the ascending part of what? The aorta. The ascending part of the aorta. And this part is what? The aortic arch. Let me label it the aortic arch. Aortic arch. And coming down will be the descending part of what? The aorta. When you look at the aortic arch, you can see that there are three main vessels coming from it. You understand? Three main vessels coming from it. The first one is called the brachiocephalic artery. Brachiocephalic artery. Brachio is related to the arms, and cephalic is related to the head. So this blood vessel actually sends blood to the what? To the arms and also what? The head. The second one here is the left common carotid artery. Left common carotid artery. You understand? And the last one is the what? The subclavian what? Artery, or the left subclavian what? Artery. Someone is asking that if this is the left common carotid artery and this is the left subclavian artery, where are the right common carotid artery and the right subclavian artery? When you look at the brachiocephalic artery, it actually branches. When it goes up, it branches into two blood vessels. And this one becomes what? The right common carotid artery, because it goes to the right side of the body, and this becomes the right subclavian artery. So the right common carotid artery and the right subclavian artery actually branches off what? The brachiocephalic what? Artery. Hope you understand. So now let's look at the conduction of what? Of the heart and also the coronary circulation. So guys, let's look at the coronary circulation. The coronary circulation is very important because it actually supplies the heart with what? Oxygenated blood, specifically the myocardium part of the heart. You see, the heart pumps oxygenated blood to the other parts of the body, but it also pumps oxygenated blood to itself, and specifically to the myocardium part. Let's look at something here. This is the aorta, you understand, the main artery, and this is the ascending part of what? The aorta. You can see that the ascending part of the aorta actually branches into these small arteries. You understand? Branches into these small arteries. And these small arteries are called the coronary arteries. Let me write it here. Coronary arteries. You understand? And these coronary arteries supplies the myocardium part of the heart with oxygenated blood. You understand? So this is the right coronary artery and this is the left coronary artery. You can see that the right coronary artery further divides into these small arteries, and this artery here is called the marginal artery. And this one here is called the posterior interventricular artery. You understand? So the right coronary artery further divides into the what? Into the posterior interventricular artery and also what? The marginal artery. Let's look at the left coronary artery. You can see that the left coronary artery also further divides into these small arteries. You understand? This artery here is called the circumflex artery. And this artery here is called the anterior interventricular or interventricular artery. You understand? So the right coronary artery divides into what? The posterior interventricular artery and also the marginal artery, and the left coronary artery divides into the what? The circumflex artery and also the anterior interventricular artery. And these supplies the myocardium with what? Oxygenated blood. You see, arteries supplies oxygenated blood to the other parts of the body, and the heart is not an exception. And veins actually drains deoxygenated blood to the heart, for the heart to pump it to the lungs, where the deoxygenated blood becomes what? Oxygenated and returns back to the heart, for the heart to again pump it to what? To the whole part of the body. So these arteries are connected to what? Veins by what? Capillaries. You understand? You see, capillaries connect arteries and veins. So the marginal artery, this marginal artery is connected to a certain vein called the small cardiac vein. Small cardiac vein. You understand? And this posterior intraventricular artery is connected to the what? The middle cardiac vein. Middle cardiac vein. And when you look at the left coronary artery, the circumflex artery, or let me talk about the anterior interventricular artery, is connected to what? The great cardiac what? Vein. And the circumflex artery is connected to what? The posterior vein of the left ventricle. You understand? So the circumflex artery is connected to what? The posterior vein of what? The left ventricle.